from Excel Academy. In this class, I'm just going to explain on how to label the thoracic vertebra. We need to understand that the thoracic vertebra is part of the vertebral column, which is also known as the spinal column. And we need to understand that the spinal column or the vertebral column, it provides as an attachment of of muscles, and it is also where some nerves originate and come from. The other thing we need to understand is that the vertebral column or the spinal column is being divided in two sections, which are the cervical, the thoracic, the lumbar, the sacrum, and the coccyx. So let's quickly look at specifically the thoracic vertebra. So when you look at the thoracic vertebra, there are some similar content that you need to talk about when you specifically describe on how to label the bones of the thoracic vertebra. So let's quickly look at this first diagram. So if you look at this diagram, someone can easily state that this is what? This is just the superior view of T6. So this is the superior view of the T6. So if you look at A is simply the body. So if you look at A is simply the body, and then B is just the superior costal facet. Let's quickly look at C. So when you look at C is just the pedicle, and then D is simply the transverse costal facet. Remember, we talked of the superior costal facet, and now we have talked about the transverse costal facet. So right now we have just identified the body, the superior costal facet, the pedicle, and the transverse costal facet. So if you look at the transverse costal surface, this facet is normally moving transversally, and then the superior costal facet, if you look at it, it is on the superior side of the of this bone. Then when you look at E is just the lamina. So don't confuse the lamina with the with the pedicle. So if you look at the pedicle is between we can simply say the pedicle is between the body and the transverse costal facet. And then when you talk of the lamina is between the transverse costal facet and the spinous process. So the spinal process and the transverse costal facet, they can help you to identify the lamina. Then from there, you can simply look at the superior articular facet. The superior articular facet. So we first had the superior costal facet, okay, which is on the costal side of the bone, and then now we have the superior articular facet. So the superior articular facet, in most cases, or it's always articulate with a certain bone, but I'm not explaining the content of that part because that has its own explanation, and in this video I'm just much focused on labeling this bone. The next thing is the superior vertebral notch, and this normally forms the lower margin of the intervertebral foramen, of which the foramen is just the one which is our last part of labeling. So please make sure that you know all these labels of this bone, which is just the superior view of T6. Let's quickly look at another view of this same bone. So if we look at this same bone and we consider the superior side of it, so let's quickly look at A. So if you look at A is just the superior articular process and and facet. Then when you look at the superior articular process and facet. There is B which is coming there, and this is just the what? The pedicle. Then from there, we can easily identify C, which is the transverse costal facet. Transverse costal facet. And D is simply the transverse process. So when we identify these guys, we can easily identify E. E is simply the inferior articular process. Remember, we first add the superior articular facet, and then we had the pedicle, which is now between the superior articular facet and the transverse costal facet, and then now we had the transverse process. From there, we can have the inferior articular process. Let's quickly look at F, which is the easiest amongst them when you are viewing from this side. So this one is just the spinous process. Okay, and then G is just the inferior vertebral notch. H is just the inferior costal facet. I is just the body, and lastly J is just the superior costal facet. So please make sure that you also know this diagram. You also know this diagram and be able to identify these parts. So let's quickly move on and look at this other bone. So if we look at this bone, we have been asked to identify A to F. So if you look at F, F is just the superior articular process and the facet. So if you look at this bone is simply the same as what we were identifying in the previous diagram. But in this case, this is not the same as this one. So if you look at this one, this is T6. And then if you check out this one, this is likely to be what? T12. But I'm not interested in knowing the differences and the like. I'm interested much in how to label, because this is very important for your exam, especially section B or C. So the first one is the superior articular process, which we observed in the previous diagram, and then we have the transverse process, which we also observed in the previous diagram. Then we have the spinous process, which we also observed. Then D is simply the inferior articular process and facet, and then E is the costal facet, and F is the body. So if you look at the content of this label and the content of the previous label, they are exactly the same. They look different, but the labeling is just the same. Let me quickly look at the diagram, which is a little bit different. So this diagram is showing T7, T8, and T9 attached together. This is simply showing T7, T8, and T9 attached together. But if you look at these bones, they look the same. They're just similar. Okay, they're just similar in some ways. So if you are able to identify the parts of the T6, then you are also capable of identifying the parts of T2, T7, T8, and T9. But in this case, these three bones, T7, T8, and T9, have been attached together. So let's quickly start with the first one. So the first one is just the superior articular process and the facet. The superior articular process and what? Facet. Then the next one is the spinous process. The next one is the spinous process. Then C is just the transverse process. And D is the inferior articular process. Then the next one is just the spinous process of T9. Remember, on B, we identified the what? The spinous process of what? Of T7. And then we went as far as the transverse process of what? Of T9. Then we have the inferior articular process, Then we have the spinal process of T9. Then let's quickly look at F. F, which is just the what? The lamina. F is just the what? The lamina. And if you look at G, G is just the seventh rib attaching to T7. When you talk of G, G is just the seventh rib attaching to what? To T7. Then the last one, which is supposed to be H, is just the what? The vertebral canal. Remember that the vertebral columns, they also play a role in the production of what? Of blood. The vertebral column, it plays a role in the production of what? Of blood cells, because of the presence of what? Of bone marrow. But that I'm not interested in it, because I'm much interested in how to label. So please make sure that you know how to label these diagrams. Make sure that you are able to identify these parts for the sake of your test, exam, and also for your own understanding in case you are examining a patient. So, ladies and gentlemen, thank you very much for joining me. In case you have any question, please make sure that you contact me on those numbers. Thank you very much for joining me. This was Dr. Possibility from Excel Academy.